Hey, it's Dr. Brian McKay, not just a chiropractor, there for Darien, New Canaan. Today, let's address chronic nerve pain. Now, you can take all those pills you want. The pain comes back. What good is it doing you? Well, you tell me. Unless you work for Big Pharma, I'm sure you've got your reasons for doing so. But pain control is a pretty tough business. I want to talk to you about a amazing treatment that we're using here. Been doing it now for almost 2 years, and it's called transcutaneous pulse radiofrequency therapy. All right. Now, if you have chronic pain, you've probably heard about ablation, radiofrequency ablation. Okay. And what they do when you get that treatment is they find out what nerves they want to kill, and they go in and they burn the nerve, and that stops the problem, we hope. Then you lose other things along when you kill a nerve. So what we've started to use is a tool that is neurosurgeons use to find the nerves. Now we're using it to stimulate the nerves, what's called transcutaneous pulse radiofrequency. A lot of simulations, a lot of big names. Radiofrequency ablation, where they burn it, okay? Pulsed is we use a stylus that goes through the skin, transcutaneous, and delivers a treatment, kind of a pulsed electromagnetic field through the skin to treat chronic pain. So unlike traditional radiofrequency, it doesn't require needles or incisions. So the pulse energy is not a continuous stream. The energy is delivered in brief, rapid bursts. So what happens is it prevents the tissue from reaching temperatures that cause damage or burning. So it's a very non-invasive way to deal with pain. Now, you may know this from listening to previous podcasts. Here at Core Health, we do neuropathy at Core Health. And that's where we pretty much work for people with, chronic demyelinating idiopathic neuropathy, peripheral neuropathy, diabetic peripheral neuropathy, chemo-induced peripheral neuropathy. And if you're familiar with neuropathy, you know that the symptoms are bad. Your legs are burning, you can't sleep at night, you lose your balance. And what's your doctor say? Your doctor goes, well, there really is no cure for it. Okay, I got you. I agree with that. There is no cure. But let's try these pills. Let's take Lyrica, gabapentin, Cymbalta. Now, for those of you who are taking gabapentin, that's anti-seizure medication. So here you have a damaged nerve, or I say sometimes a dying nerve. What you do is you kill it off. That's one way to get rid of the problem. If you have an ant infestation or cockroach infestation, kill them off, solve the problem. Well, what happens here is you're able to change the state, the way nerves work. There's a firing pattern. And when the nerve is not working properly, it's easier to fire, so you have more symptoms. That's why someone with, let's use diabetic peripheral neuropathy. So in the beginning, you're going to have a lot more symptoms, okay? And then after a while, those symptoms start to change out. Maybe you don't have as much symptoms. Maybe you're taking the gabapentin, Lyrica, Cymbalta, whatever. But now at this point, what happens is you start to get numbness and tingling or burning. So different sensations, different types of nerves, okay? But so what I tell people is it's actually more serious. There's 9 different types of nerves in the body. Only 2 deal with pain. Pain gets shut off, you think you're healed. Well, if you are, great. But a lot of times you're not healed, okay? And these other tissues, these other nerves that provide feedback to the brain are not getting it. So if you're old enough to remember the old phones we used to have, if you left it off the hook, well, you hear that beeping. That beeping just wouldn't go away until you wouldn't put the phone back on the hook. In this case here, until you treat the nerve, that phone's off the hook, whether or not you're getting pain. And listen, most people are dealing with pain and say, hey, I'm out of pain, I'm better. I see it all the time. And what happens there is we have to address this level of pain, okay? And we have to address it when we use transcutaneous pulse radiofrequency. We have the benefit of bringing homeostasis about to the nerve to calm the nerve down and let the nerve work properly. And that's how we treat pain. Now, If you want to take medication for it, great. Then obviously you have nothing to talk about, which is, listen, if you're happy with you taking pain medication, take it. But someone with chronic idiopathic demyelinating peripheral neuropathy, someone with peripheral neuropathy due to diabetes or chemotherapy, these things just don't go away. So you got to bring about normal homeostasis to let the body heal itself. Okay? You got to let the body heal itself. And that's what happens here is, okay? So what happens is you modulate the nerve sensitivity, and the relief comes from the electrical field itself, not heat as they do with some of them with the burning with radio frequency ablation. So what happens here is the field alters the cellular signaling, and it quiets the hyperactive pain receptors at a molecular level. So it's a molecular level. Transcutaneous means across the skin. So it's an advanced delivery system that we use, the Stimpod NMS460. So you project these neuromodulating fields through the skin to the target tissue, and basically people get better. The pain goes away. It normalizes the tissue, and it interrupts the central stimulation, the process where the nervous system stays in a high state of reactivity. And without getting into more and more technical detail, understand, in the beginning, the pain goes up. When it starts coming down, that's when you have the problem. You get the more numbness thing and stuff like that. So we've started to use this for a bad case of back pain. Back pain doesn't, listen, I'm a chiropractor. If you don't respond to this, we have another treatment that sometimes does very good where traditional chiropractic doesn't, because like anything else. Chiropractic doesn't cure everything. I'd like to think so, but I'm telling you the truth, it doesn't. But it does help many things. We're using it for migraines, and we're doing some great work with the migraine cases using the Stimpod NMS460, which delivers the transcutaneous pulse radio frequency therapy. So that, and of course, we've been doing neuropathy for many, many years at this point. It's kind of what they're talking about as being a new era of neuromodulation. So it's a sophisticated way of modulating the nervous system without, using destructive temperatures in form of heat to burn or invasive procedures. So it makes it a lot easier. And this thing really came about kind of like in the 2006, 2007. So listen, it's 2026. I understand that. But back in the 2023, some of the research started coming out, and it also saying that the transcutaneous pulse radio frequency therapy helps restore balance by reducing oxidative stress and modulating inflammation at a fundamental level. So that is really some pretty good stuff. But Big Pharma is not going to let you take, pulsed radio frequency or transcutaneous pulse radio frequency. They want you taking the gabapentin and being, I don't know if you know this, but most Americans are on 4 medications. It's not a problem with the medications, it's a problem with the healthcare system. So if people want to take charge of their own health, this is a way to do it. You have neuropathy, peripheral neuropathy. The only thing we won't really take is alcoholic-induced peripheral neuropathy, because you got to stop drinking. Otherwise, it's not going to do anybody any good. So I'm Dr. Brian McKay, and then usually it's chiropractic talk, but today is talking more about neuropathy. And I think you have hopefully a better understanding of a really radical new way to treat neuropathy symptoms using transcutaneous pulse radio frequency. As far as I know, we're the only people in Fairfield County using it, which makes us one of the biggest providers of natural peripheral neuropathy relief in Fairfield County. So if you have any questions, give us a call, 203-656-3636, 203-656-3636. All right. Have a great day. Talk to you soon.